Hi, this is Dr. Robert Silich, and this is a presentation that I've put together, which is a compilation of a bunch of talks that I've given in the past. I am a plastic surgeon. I am a clinical assistant professor of plastic surgery at Cornell University Medical College in New York City. And this is a talk, as I mentioned, that I like to give to prospective patients. I found that over the years of doing this, that the more information patients have prior to seeing a plastic surgeon, or if you're at least even entertaining the thought about having something done or wondering when you should have something done, that the more information you have prior to getting to the doctor's office is the better. So now comes the important part. What should you have done? Well, no matter what anybody tells you, less is always, always, always more, and you always want to do less early rather than a lot more later. The concepts that we talked about facial harmony are important, and again, I've always thought that if you can find that one feature, because usually that's what it is. It's usually your lower eyelids, or it's your upper eyelids, or it's something on your nose, or it's something on your neck. Usually that one small thing, if you can change that rather than do an entire overhaul of all of your features, that usually will achieve the goal that you want and get that look. And the key is really to try and find out what that one feature is going to be. So next, let's just look at a few patient examples. This lady is on my website, and basically she had one procedure done, which is she had her upper eyelids operated on. If you notice on the upper slide, she has some very full, crepey skin above her upper eyelashes, and she's compensating for that, if you notice, by raising her eyebrows. And her right eyebrow is a little bit higher than the left eyebrow. When I discuss right and left sides, I'm always going to be talking about the patient's right. So when you're looking at it, it's to your left side, but it's actually the patient's right eyebrow. This next slide is the lady who had not only her upper eyelids operated on, but she also had her lower eyelids operated on. And there's a little bit of a discrepancy in this picture, which is actually an important point, which I also tell patients. And that is, notice that the postoperative photograph, the patient is wearing makeup as opposed to not wearing makeup in the preoperative photograph. Now, that is an accident, and I'm pointing it out on purpose, but a lot of times you will see this when you look at doctors' books and you look at before and after books. That is a kind of, sleight of the hand or a trick that they do, which I always think is a little bit disingenuous, because the problem is, without the makeup, you're kind of comparing apples to oranges. Having said that, even looking at the difference in the makeup, I think you can see that the fullness in her lower eyelids and the bags have kind of really been alleviated. And that's done really without removing any skin at all and without removing fat, but rather repositioning the fat and filling in those hollows underneath, which are called tear troughs, with a little bit of the patient's own fat. And again, this is the facial photograph of the same patient. She has the upper eyelid surgery done on the right. She's also had some surgery done on her neck, which you can see in this profile shot. Concentrate on the angle of the neck. If you look at the dark compared to the light part of the slide, the light part obviously being her skin and the dark being the shadow behind it, you notice that the angle underneath her chin on the left side is much more oblong compared to the angle on the right. And what we're always trying to look for is to approach somewhat of a 90-degree angle. And that's called the cervical mental angle. What that basically means is the neck-chin angle. And that's something that will give someone the appearance of either having lost weight or having a much sharper jawline simply by doing a small amount of liposuction in that area. And again, this is just, again, a close-up of that angle. If you notice, there's a big difference underneath the neck and the chin with the angle and the way that the skin drapes. Again, no skin has been removed, only redraped in this area after the liposuction is done. This patient also has something, by the way, known as a witch's chin deformity, and that's kind of from the common cartoon caricature of what a witch's chin looks like. It's an overhanging chin, which you can see on the top, and that's flattened out not only by the liposuction, but again by redraping the skin underneath the chin to give it a much softer contour. This is another lady who not only had her lower eyelids done, but she also had a limited incision facelift, which is a mini facelift, which kind of lifts the middle part of the face to get rid of the lines around the mouth. You notice there's a big change in her lower eyelids where she had these large bags before. Now they're nice and smooth. She also has a lot more lightening in the skin on the photograph postoperatively on the right, and that's from a chemical peel that we performed. And again, this is a close-up of this lady's eyelids. You can notice we did nothing on the upper eyelids, which again goes to that concept of leaving something that's slightly imperfect. Could you take skin out of the upper eyelids? Absolutely, but I think it would probably be too severe. And the lower eyelids needed so much work that I think that alone really made the difference. This is another patient. You're looking at a lateral view of the eyelid. Again, the eyelid on the right, which is the postoperative eyelid, does not necessarily look overdone or look that youthful. In fact, you can still see a little bit of crow's feet there. What we've done, though, however, is to reshape the form of the eye so that it doesn't look as heavy and doesn't look as bloated as it did on the left. This is another patient with eyelid surgery. Again, the upper eyelids were left alone, which are fairly full. However, compared to the lower eyelids, which have the fullness, the rejuvenating photograph on the bottom is a lot different than the picture preoperatively on the top, and the difference really is only in one procedure alone, and that's just to remove a small amount of fat in the lower eyelids in the postoperative photograph as compared to the preoperative photograph. Nothing else was done. And this is what I mean when you talk about getting one small procedure, which can be the success for that overall facial harmony. This, again, is a young patient, and I love to use this photograph as a pre-op and post-operative photograph because this is, first of all, actually the daughter of the first patient I showed you who had the upper eyelids done. But what's beautiful about this picture is she looks so dramatically different from the left and the right, but most of the difference were things that we talked about that actually had nothing to do with surgery. She did have some surgery done, and the surgery that she had done was to her lower neck underneath her chin. You notice she has a much sharper jawline on the right as compared to the left, and she has a nice sharp angle underneath her chin, which makes it look like she has a much longer neck as compared to the left. We also did some liposuction to remove some of the fat underneath her chin. But the main difference is she lightened her hair, she changed her makeup, and she also got a very, very good skincare regimen done, and you notice she has some acne scarring on the left and some active acne areas, which are all cleared up on the right. So again, a bunch of small little tiny things, the least of which was the surgery, that actually made most of the difference. And that's the last slide that I have for you. So I'd like to thank you for listening, and there are going to be a lot more questions, I'm sure, that will come up on the blog, and feel free to contact me at any time for that. Thank you so much for your time.